Okay, let's talk about healthcare. Have you ever just felt completely lost? Like you're trying to navigate this maze and there's all this jargon flying around?
Oh, absolutely. It
You're
feels
feeling
like learning a secret code sometimes.
exactly. And two terms that always seem to pop up and cause confusion are prior authorization and referrals. You hear them, but it's like, what do they actually mean for me, for my care?
Hmm.
So today, that's our mission. We're going to take our sources and really try to untangle these concepts, cut through that jargon, so you can feel a bit more in control.
Yeah, and it's important because, look, it's easy to just write these off as, annoying bureaucratic hoops to jump through,
Right, just
just
paperwork.
paperwork.
Yeah.
But fundamentally, they're tools that insurance companies, the payers, use to manage costs. And also to try to make sure the care you're getting is, well, medically necessary and appropriate for your situation.
Okay.
But, and this is a big but often missed, these processes put a huge administrative load on doctors and hospitals. And sometimes, honestly, that burden itself can slow things down, maybe even get in the way of getting timely treatment. So understanding how this works isn't just about dodging a surprise bill, though that's important too.
Very important.
It's really vital for actually getting the care you need when you need it.
That's a really critical angle. Okay, so let's dive into the first one. Prior authorization, sometimes called PA, right?
Yep, PA.
What exactly is that?
So prior authorization is basically a checkpoint set up by your insurance company. It means certain services or medications or equipment, they have to be approved by the insurer before you actually receive them. That is, if you want the insurance to cover the cost.
Okay, so before the doctor does the thing, they need a green light from insurance.
Pretty much. And we're talking about a whole range of things here. It could be advanced imaging, MRIs, CT scans.
Be expensive tests.
Exactly. Surgeries often need it. High-cost prescription drugs, definitely. Sometimes even hospital stays or specific kinds of therapy.
Wow, okay, so how does that work? Does the doctor just call them up?
Well, your provider, or maybe this facility like the hospital, submits a formal request. They have to include medical justification why you need this specific thing. That means setting clinical notes, lab results, that kind of evidence.
Right, proof.
Proof, exactly.
Yeah.
Then the insurance company reviews it. And believe me, the number of these requests is just massive, millions every year. If they approve it, great, you're good to go.
And if they deny it?
If it's denied, your provider can appeal that decision. But here's the kicker. If you just go ahead and get the service without getting that required PA first,
Uh-oh.
yeah, the insurance company will almost certainly deny the claim later. And that means you could be on the hook for the entire cost yourself.
Oof. Okay, that's a serious financial risk. So, PA is about getting the service approved beforehand.
Correct.
Now, you often hear referrals mentioned in the same kind of conversation, but you're saying it's different. How so?
It is distinct, yeah. A referral is different. It's essentially a formal recommendation or order from your primary care provider, your PCP, sending you to see a specialist.
Ah, okay. Like my main doctor saying you need to see the heart guy.
Exactly like that.
Yeah.
Now, not every single insurance plan requires referrals, but they're very, very common if you have an HMO plan.
HMO, Health Maintenance Organization.
That's the one. In an HMO, your PCP is typically your main point of contact, the one who coordinates your care.
So the referral is part of that coordination. My PCP is kind of like a gatekeeper, guiding me to the right specialist within their network.
Precisely. That's the idea. It's about coordinating care, making sure you see an appropriate in-network specialist for whatever issue you have. Your PCP assesses you, decides specialist care is needed, and then issues that referral, usually electronically these days.
And the specialist needs that referral.
Yes, the specialist office will typically verify they have that referral before your appointment. And here's where you need to be careful. Always check if you need one. Because if you show up to that specialist appointment and a referral was required, but you don't have one,
Let me guess, insurance won't cover it.
you got it. Your visit, and maybe anything that follows from it, might not be covered. You could end up getting billed for the whole thing.
Okay, so they sound related. Both are kind of permissions, but they're triggered differently and approve different things. Can you just crystallize that difference for us one more time?
Absolutely. It's probably the most important distinction. Prior authorization, the PA, is usually started by the provider doing the service or the facility, and it approves a specific medical service or treatment. Think.
Oh.
The MRI scan itself, the surgery, the specific drug. It's the green light for the procedure.
Got it. Service approval.
Right. A referral, on the other hand, is usually started by your PCP, and it approves your visit to see a specialist. It's the green light for you to go to that cardiologist or dermatologist, especially within that HMO structure where the PCP manages your care pathway.
Okay. PA for the service, referral for the specialist visit.
You nailed it. Both are crucial, though. Missing either one when it's required by your plan. That often leads straight to denied claims and you potentially paying out of pocket.
Yeah.
A common mistake is thinking, oh, I got a referral, so the MRI must be covered, or vice versa. They're separate checks.
Wow. Okay, so knowing that difference, knowing PA covers the service and a referral covers the specialist visit, especially in HMOs, that feels like a really powerful piece of information. It's like a shortcut to avoiding those nasty surprises, the denied claims, the unexpected bills.
It really is.
Just got to remember, PA service, referral, specialist visit.
Exactly. And maybe this brings up a final thought, something for you to really consider. Beyond just knowing these definitions,
Yeah.
the most powerful tool you have is understanding the specific rules of your insurance plan. What does your plan require for prior auths, for referrals?
Yeah.
Because it varies.
But not all plans are the same.
Not at all. So the question becomes, how often should you be proactively checking these things? Maybe even for visits that seem routine, just to head off any potential problems down the road.
That's a really good point. Don't assume, always verify with your plan.
Absolutely. Staying informed, asking questions, talking to your doctor's office, talking to your insurance company. That's genuinely your best defense in this healthcare landscape that, let's face it, is always changing.